Okay. I'm going to go ahead and call the meeting to order. Hopefully Dave will get here in a little while. So, has everybody had a chance to look at the minutes, I hope? Any suggestions of changes, additions, corrections on the minutes from August 27th? Nothing? Okay, then I guess we'll go ahead and a motion to approve the minutes.
I move we approve.
Second that.
Approved and seconded to accept the minutes from August 27th, 2025. All in favor, say aye.
Aye.
Opposed? Okay, that's good. The agenda, anybody want to add or change anything on the agenda for tonight? Okay. Again, need a motion?
Motion to approve.
Second.
Yep. Moved and seconded to accept the agenda as presented. All those in favor say aye. Aye. Opposed? Okay, then we'll get on into the regular stuff. Go ahead.
Okay, so under requests for funding, we've got 4 proposals tonight. The first one is for next year, so 2026, Live Well Kosciuszko mobile mammography is the project. They are wanting $10,000 for the project. It will run January 1st through 2026 through December 31st, 2026. And what their project will entail, they did some research and approximately 80,364 residents live in Kosciuszko County. It is a rural community. 2022 community needs assessment conducted by Parkview Health identified cancer as one of the top health concerns. So for that, the highest age adjusted incidence rate for breast cancer was reported for Kosciuszko County. From 2016 to 2020, Kosciuszko County had an age adjusted female breast cancer incidence rate 139.3 per 2,000 women and a mortality rate of 10 per 2,000 women. So compared to all Indiana counties, Kosciuszko ranks 18th in breast cancer incidence, but 70th in breast cancer mortality. And then what they are planning to do is partner, and actually this is already in place, so they've been doing it this year. They've partnered with Parkview's Francine's Friends mobile mammography coach. So they did an event at the Warsaw Public Library recently and had people that could come and get screenings through there. They've had a good response with that. So this would just be continuation for 2026. It does hit our access to and linkage to clinical care KPI, along with the chronic disease prevention and linkage to clinical care core services.
Okay. Any discussion, questions on this one? Anybody? Okay. If not, entertain a motion to approve that MOU, request for funding, did say?
I move we approve the $10,000 for the breast awareness.
Got a motion to approve the $10,000?
And I second that.
Okay. Moved and seconded to accept the motion for mammography for Live Well. Any other questions? Anything? All those in favor say aye. Aye. Opposed? Okay.
All right, next one is for 2026 as well. It's for Live Well Kosciuszko. This one is just to continue our partnership that we already have in place. We've had in place since 2024. Well, we are addressing chronic disease and obesity, and then the student health core services. They are asking for $95,000 for the project. It will run January 1st, 2026 through December 31st, 2026. And then for their project, they aim to prevent and manage chronic diseases that significantly impact the health of Kosciuszko County residents. Chronic diseases such as diabetes, hypertension, obesity, heart disease, and cancer are among the leading causes of illness and death in our community. Many of these conditions are preventable or manageable through evidence-based interventions, early detection, and access to supportive services. So they're going to address that in the much needed areas of the county as well as other areas. And they're going to provide education. Certain screenings and assessments can be done, and they're going to hit the KPI for heart disease, as well as some of the state KPIs. And then the core services, chronic disease prevention, linkage to clinical care, maternal and child health, and student health.
Any questions, discussion? Anything there at all, anybody? I'll make a motion to accept this request for funding for $95,000 for Live Well. Is there a second?
Second.
Moved and seconded to approve this request for funding. All those in favor say aye.
Aye.
Opposed?
All right. Third one is for 2026 as well. This one is for the Northern Indiana Maternal and Child Health Network, also known as NIMCHN. It's a continuance of our partnership from this past year, 2025. They are asking for $60,596 for their project. NIMCHN is requesting these funds to continue its progress in strengthening community outreach and sexually transmitted infections education efforts to Kosciuszko County through the coordinated work of its disease intervention specialist, community outreach specialist, and medical staff. Focuses are on expanding STI screening, treatment, education, and referral services, assisting in providing efforts to decrease the infant mortality rate. STIs can significantly increase infant mortality rates. Strive to reduce injury rates in at-risk populations by providing care packages. Those include drawstring bag that contains hat, gloves, socks, blanket, rain poncho, mini first aid kit, antibiotic ointment, burn cream, lip balm, lotion, soap, body wipes, Kleenex, toothbrush and toothpaste, deodorant, and community referral information.
Any questions or discussion on this request for funding? Anybody? Okay, then I will make a motion to accept this request for funding for the $60,596 for NIMCHN.
I second that.
It's moved and seconded to accept. All those in favor say aye.
Aye.
Opposed?
Okay. And then we have the Warsaw Community Schools School Health Liaison. They are requesting $82,000 for the program. It's a continuance of this year as well, 2025. We did talk to all of the, well, I should say most of the school nurses that the liaison works with. They all had wonderful things to say about her. They saw how passionate she is about what she's doing for the schools and in the community. One of the nurses also recommended that we create a template for like a support letter. So I did get that sent out last week. I did receive 3 of those back. I'm guessing more are going to be coming in. But that just pretty much states that they are in support of the position through Warsaw Community Schools and continuing this on for next year. Some of the, well, one of the success stories was she was able to get into Tippecanoe Valley School, talk with the superintendent there, and they did have an immunization clinic, and they were able to reach, how many was it, Lori? 17 students through that. So they're hoping to continue it each year and then gain more people, more students through that.
Okay. Questions, discussion, anything?
I just want to say, I think this is a good program for the schools because they have a cohesiveness, and then it's not just Warsaw schools, it is involving the whole county. So I do think that's really important. It gives them an outreach, a way to share some of their thoughts and concerns and probably come up with good answers for them.
And another thing I'd like to add too is we did announce that we're not going to be able to partner with the schools like we have in the past with the HFI funding due to the budget cuts. So this will still be a way that we can stay connected with the health department and the schools. And also another thing that the nurses have said is Lori has been very instrumental in providing resources to the schools that they didn't know were out there in the county. So I felt like that was very, very important.
Any further discussion? Looking for a motion to accept this?
I'd move we approve.
Moved and seconded to accept the motion for funding for Warsaw Community Schools Health Liaison. All those in favor say aye.
Aye.
Aye. Opposed? All right, so the next topic, NIMCHN disbursement.
So we do have a little bit of an update for the NIMCHN addendum. So this was, we discussed with them that they didn't need all of the funds that were in their proposal. They had asked for 82,000, and we had given them the first half of the funds. And then for the second half, they didn't need all of that. And that was due mostly in part to they didn't get their first half until around April. So they didn't start those programs until later. So we are asking the county attorney to review the addendum form. And once we have approval on that, then we'll go ahead and have both parties sign that. And then that'll be about $30,000 that will be in the HFK account. And they will receive their portion. I believe it's around $11,000, $12,000.
Okay. So we'll move on to the next section there, IDOH funding cut.
Okay. So IDOH, they sent out an email to us, I believe it was last month, and they were just asking for all of the local health departments to fill out a survey, just describing how the funding cut has impacted each county. So we did complete that, and I'll just go over that kind of briefly, some of the questions. So the first question was, have you already or will you cut funding designated to community organizations, partners to provide public health services? The answer was yes to that. Did you cut funding designated to community organizations, partners in 2025, 2026, or both? And we have just cut in 2026. What core services were impacted by the funding cuts to community organizations? The funding cuts impacted maternal health services, chronic disease and obesity prevention, youth vaping prevention, access and linkage to clinical care, infectious disease prevention, including TB, syphilis, and HIV/AIDS, student health, school health liaison. And most of those impact our partners that we currently have and that we have up for next year. Please provide an estimated dollar amount of maternal health services. That was around 13,000. Provide examples of maternal health services provided by community organizations that were cut. That was contraceptive education, STI testing events to educate and test pregnant women, especially in underserved communities. Please provide an estimated dollar amount of chronic disease and obesity prevention services provided by community organizations cut. That was around 190,000. Please provide examples of chronic disease and obesity prevention services provided by community organizations that were cut. Coalition Maintenance and Engagement, Living Well with Diabetes program, educational workshops, Libraries with Heart program, referrals to chronic disease management resources, diabetes prevention programming, cancer screening events, SNAP coordinator, Double Up Bucks program, Food as Medicine program, Meeting the Need program, literacy tutoring, including health literacy paired with physical education for students. They also asked, please provide an estimated dollar amount of youth vaping prevention services provided by community organizations cut. That was around 61,000. Please provide examples of youth vaping prevention services provided by community organizations that were cut. That impacted Coalition Maintenance and Engagement, vaping and tobacco prevention education for youth, Catch My Breath, In Depth, and other prevention programs, updated school policies, Voice Club. The estimated dollar amount of access and linkage to clinical care services provided by community organizations cut, that was 0. Please provide examples of access and linkage. We didn't really have anything pertinent there that our partners were doing. Please provide an estimated dollar amount of infectious disease prevention, including TB, syphilis, and HIV/AIDS services provided by community organizations cut. That was around 18,000. Please provide examples of infectious disease prevention, including TB, syphilis, and HIV/AIDS services provided by community organizations that were cut. STI testing events and services, testing kits and outreach, care kits, including services to address syphilis and HIV. Please provide an estimated dollar amount of student health, school health liaison services provided by community organizations that were cut. That was around $432,500. That was our schools. Please provide examples of student health, school health liaison services provided by community organizations that were cut. Stocking food pantries, first aid response kits, stocking clothing and hygiene closets, providing emergency medications, mental health therapists, welcome center initiatives, hydroponics and health education program, and Boomerang backpack program and their mentoring program. Have you already or will you cut funding designated to your local health department activities to provide core public health services? Yes. Did you cut funding designated to your local health department in 2025, 2026, or both? 26. And what core services were impacted? And those were maternal health services and infant and children health services. And this is for the local health department. Please provide an estimated dollar amount of maternal health services provided by your local health department that were cut. That was 13,000. Please provide examples of maternal health services provided by your local health department that were cut. Social media marketing and radio advertisements for the early start prenatal program through the health department. Fuel and grocery cards to help those in need, and cribs to promote safe sleep. Please provide an estimated dollar amount of infant and children health services provided by your local health department cut, $1,800. Please provide examples of the infant and children health services provided by your local health department that were cut. Purchase of cribs to provide to families in need and to promote safe sleep. If you did not spend all of your funds in 2024, please share why. It took longer to establish funded partnerships than anticipated, took longer to get budget approval than anticipated, and please describe why you were not able to spend 2024 H5 funds. The 10% capital reserve money our health department set back was determined not to be spent. Proposal and MOU approvals took longer to obtain due to the slow funding process. The data will be shared with legislators, state budget committee, and other stakeholders. Therefore, the information you share is very important. So that was all of the information that we provided to them. I do have a little bit more detail if anybody has any questions, but that was the survey. Any questions on that? I know it's a lot of information.
Anybody on that at all? Okay, go on then. Funding plan.
Okay, so the 2026 funding plan that we've been working on since around March, April. So we did have the county council, they approved our budget. So we now have concrete numbers to work with. What we have been working with in the past on the 2026 plan options spreadsheets that I've been giving you, those were estimated amounts. So this new one, the top left corner, it shows you that we have 2024 uncommitted remaining money. That amount is $152,879.27. 2025, that's going to fluctuate depending on if we want to spend more money in 2025. And that is $320,257.41. And then for 2026 and 2027, they're the same amount. That is $37,312.34 for each year. And then down there at the bottom, most of this has not changed for what we plan on doing in 2026, as long as everything is approved and works out. So we've got Chronic Disease and Obesity Coalition, that $95,000 from earlier that we want to recommend to the Board of Health. We've got NIMCHN at $60,596 that we're recommending to the Board of Health. Early Start Prenatal Program, we are working with around $6,000 for next year. That will include hopefully more social media marketing. That's been going pretty well. Warsaw Schools School Health Liaison, which we just voted on, and we're recommending to the Board of Health for $82,000. Already approved YMCA Indoor Fitness for Active Older Adults for 2026. That amount was $11,085. Mobile mammography, which was a proposal tonight that we're recommending to the Board of Health for $10,000. That's for 2026. And then we also have listed some money, and this may fluctuate as well, for special projects. So maybe different programs that come up next year or in between now and then that we'd like to provide some funding to. That's about $7,000. And then Health First Kosciuszko, education and events. So that would be anything that would kind of help us to gain more knowledge about things within the county or in the state. And then just bringing awareness to different health initiatives. That's $1,400. Health First, the Chamber of Commerce membership to be connected with the community. That's around $305. And then printing companies. So for marketing promotion for ourselves or for our partners to kind of help there, we've listed $500. So for 2026, the awarded amount by HFK, if everything is approved, we're looking at $273,886. That will leave money remaining for 2024, 2025, and 2026 in the amount of $236,563.02. So adding that with what we have for 2027, that $37,312.34, that gives us the 2027 Health First Indiana money in remaining amount of $273,875.36. So 2026 and 2027, that was my plan, to try to make them as even as possible so that we could continue the partnerships that we have in 2026 into 2027 if we approve.
Any questions? You can digest that.
I don't think
that
so.
quickly.
I guess my only question is, so just because I was trying to listen. So we won't, if we do this, then the funds are basically already like whatever allotted for these next 2 years. And we know these services will continue, but there's not a lot of cushion to take on additional projects. Am I right in thinking that?
Yeah, so
Okay.
that special projects that's listed there,
Mhm.
that would be the additional. The only
Okay.
other way that more funds would come in is if we decide not to partner with the partners we established for 2026 going into 2027. That makes sense.
Yeah, well, again, and the money at the top there is part of it.
Yeah, yep. So that's why the 2025, that 320,000 may fluctuate, is if you see there at the top, money may not use in 2025. So fuel cards, grocery cards, car seats, cribs, sleep sacks. We did initially have money set back for Sacred Heart in case they needed it, but now we're at the end of 2025. So that will more than likely go back in. And then we've got the addendum with NIMCHN that we're waiting on. So that 30,000 would also be added back in. So that 320 could go up. And that would give us more money to, you
For
know,
special
even-
projects or
yeah.
something that came,
Mhm.
okay.
Okay. Any other question on funding right now?
This is very good. You've done a good job with
Thank you.
this. I could actually follow what you were saying. Studied it before it came, obviously, but yeah.
Thank you.
Good.
Sarah has helped me quite a bit on that too.
Okay, teen pregnancy, KPO.
Okay, so we initially said that we weren't going to address this one. So the teen pregnancy KPO, I do want to kind of touch on that. It's in new business, but I want to address it now. So IDOH, they just told us recently that they're changing key performance indicators, so KPI, to key performance outcomes, so KPO. So you'll see that difference in the paperwork, but we are referring to it as KPO now. They wanted to, instead of indicator, kind of speaks more about just the data, just those certain things, but they want to also incorporate the success stories, what it's actually doing in the communities too. So that's the outcomes. But teen pregnancy KPO, we initially said that we weren't going to do anything with that. We do have a little bit of money now, because that was basically because we didn't have, you know, the money to do anything. So we're kind of discussing that to see what that may look like. Either we might be able to provide funding, or we might try to do something without funding. So that is back on the table.
I feel like with this the liaison, I think that's where you're going to hit a lot of it. And so I don't think you have to spend a lot more money, because it's already, that program is there. So it's just having that focus throughout. I think the schools is going to be a huge part of hitting that.
And I think trying to figure out what that is too, because the standards I think may have changed in the schools a little bit this year. So just kind of looking at what curriculum they have.
Yeah.
Okay, anything else? Anybody on that? Okay. Status proposals 8.0.
Okay, so just real quick, just letting everybody know where we're at with some of the other proposals that we've seen. So for the next Board of Health meeting, which is on next Monday, October 27th.
Oh, November 3rd, right? We changed it, didn't we? Yeah, okay. November the 3rd.
Oh, okay. Noted. Okay, so Monday, November 3rd, we're going to have Magical Meadows, the AED proposal. That was for $2,475, so it'll go through the Board of Health for approval. Fellowship Missions Nurse Practitioner, that proposal for $15,000 will also go through the Board of Health on the 3rd. And then approval process completed. So the YMCA indoor fitness for active older adults, both the 2025 and 2026 proposals, those are completed, other than for the 2026 proposal. Of course, they are going to get their funds next year. So that was $12,005 for 2025, October through December, and then $11,085 for January through April of next year. Pasco County Clubhouse was the other one that has been completed. They've received their first half of funds, or it's been sent out to them. That was in the amount of $15,000, and that was for July through December of 2025.
They didn't get this, right? Everybody.
No, I have that at the end. I was going to tell them, but we can bring it up now. So they are going to do a news release for the YMCA indoor fitness for active older adults. Let me find that. They've got Minton, Milford, and Pearson. Okay, thank you. So Minton, Milford, and Pearson are the rural communities that they're going to be serving. And this is a pilot program. So if it does really, really well, then they're going to continue it through the YMCA. But the classes will be held in Mentone at the Bell Memorial Library on Mondays and Wednesdays at 1 p.m. Pearson Community Building, so that one will be on Mondays and Wednesdays at 10 a.m. And then Milford Community Building, that will be on Mondays and Wednesdays at 3:45 p.m. And they've got a lot of different information out there for it. If you have questions, you can reach out to myself. You can also reach out to Tracy Frick. It's tfrick@kcymca.org is their email. And she'll be able to direct you to that information. But we're kind of excited to see how this progresses.
Okay. Any other questions on those, the proposals and everything? Okay, old business, stop the bleed kits.
Yep. So we were able to get the Stop the Bleed kits ordered with the help of our school health liaison. And they've been received and distributed to all of the schools now. So Warsaw, Wawasee, Pearson, Tippecanoe Valley, Lakeland, Sacred Heart, and then we've kept one for training purposes. Those are all out to the schools, and we're excited for that.
Go ahead and do business then.
Okay. So under new business, I just want to let everybody know that Health First was able to attend the Family Safety Day. That was on September 13th. And we have some numbers here for you. I don't have an overall number of people that came through because it was outside and inside, and it's hard to count that. But people that actually stopped at the HFK booth, that was 81 individuals, 40 adults and 41 children. We had some coloring pages for the kids. We had some stickers, and then we had some general information regarding lead screenings, just chronic disease and health information, fall prevention information. We had things for our partners like Live Well, some information from NIMCHN. I believe you guys were there too, weren't you? Okay. So just different things with health. Number of people that we had educated on 9888 in crisis resources was 6. We educated and trained on water safety to 15 individuals. Number of people educated in fall prevention, we had 4 people that took brochures. Number of people provided, oh, I do want to touch on that one. So we had a success story coming out of that. So we had a lady stop by. She had osteoporosis and she had fallen recently. And so I described to her the fall prevention program and different programs in the community, and she was very grateful for that. So I thought it was pretty neat that we actually had somebody that could use the services. For number of people provided with infant safe sleep education, including families and professionals, we had 7 people. Number of families provided lead education was 17. Number of people provided early start prenatal program. We had ordered Helen from the program some cups to use in the clinic, but I had asked her if it was okay to take some of those to kind of get the word out about the clinic itself and the program, and she said yes. So we took 20 of those, and out of the 20, we were able to provide those to 13 people. So I thought it was a pretty good success, and there were so many different organizations, and I love doing that where we can all just be in one place and give out those resources. Okay. And then going on, the Health First Kosciuszko letter of support, it's kind of in progress right now, so just working on that. And then I want to let everybody know that we did receive word that Dr. Lindsay Weaver is going to be coming around to the different local health departments, kind of like what she did at the beginning of Health First, kind of to see where all of the counties stand, their progress, their accomplishments, and also how the funding cuts have impacted the counties. So we don't have a date yet. We're waiting to hear, but they're supposed to send us some information so we can kind of prepare for that.
You want to go over the food insecurity stuff then?
Yeah.
Go ahead.
Yep. So the other thing that we kind of wanted to talk about was food insecurity. So we did get approval for funding it this year. So that was July through December of 2025. And that was for different programs, double up bucks, having a SNAP coordinator, different things like that to address food insecurity in the county because it is an issue. We just recently had a meeting about that. It seems that it is still a great issue. It's not going to go away. So we're kind of looking at different ways, either with funding or without funding, that Health First can kind of help with that. So we're just kind of talking within the health department and with different partners and things to get an idea of what that might look like for next year.
Any comments on food? Anything there?
No, I just see that with all of our patients as well. It's a big deal. And then as SNAP funding goes, it's going to be even more important for those moms and babies. Yeah.
Yeah, there's a lot of programs being cut, and that's going to affect people for sure.
I mean, I think both of us think that if we have extra money like that, $30-some thousand, that's where it should go probably. I mean, indirectly, not in some program, actual food,
Right.
or in some way, shape or form. At least I think
Yeah.
you agree, right?
Yeah,
As much
yeah,
as we
giving
can.
money directly for either food, providing that, or education on where to find it, just direct money towards it.
Okay. Any other new business, anybody, or anything to bring up? Okay. Then at this point, the next meeting is scheduled for Wednesday, December the 3rd. So otherwise, anything else, anybody?
But I will not be here December 3rd. I'll be at the conference.
Okay. Okay. Otherwise, then we're adjourned.
Thank you, Evan. My friend at the end of the table will not be here.
I don't know how it's on Monday. I mean, that week I did not have that on my calendar. I better get it on there.